Hi, my name is Catherine and I'll be demonstrating how to perform a manual blood pressure measurement. I'll walk through each step explaining both the technique and rationale behind it. For this skill, you'll need a manual blood pressure cuff and a stethoscope. It's important to make sure the cuff is the correct size for the patient as it directly impacts the accuracy of the measurement. First, I'm going to introduce myself to the patient and explain the procedure. Even for a simple skill like this, it's important to ensure the patient understands and is comfortable. I'd also verify the patient using 2 identifiers. Next, I'm going to make sure the patient is positioned correctly. The patient should be seated with their back supported, feet flat on the floor, and legs uncrossed. The arms should be supported at heart level. Proper positioning is critical to obtain an accurate blood pressure reading. Next, I'm palpating the brachial artery. This helps guide correct placement for the stethoscope and ensures that I am listening to the correct location for the measurement. I'm placing the stethoscope over the brachial artery. I am now selecting the appropriate cuff size. The cuff bladder should cover about 80% of the patient's arm. I'll be placing the cuff about 2 to 3 centimeters above the antecubital fossa and align the artery marker with the brachial artery. I will now inflate the cuff to about 20 to 30 milliliters of mercury above the estimated systolic pressure. Now I am slowly deflating the cuff at a rate of about 2 to 3 millimeters of mercury per second. The first sound I hear is the systolic blood pressure. I will continue to deflate the cuff to the point at which the second disappears is the diastolic blood pressure. The blood pressure is within normal range. If the readings were elevated or abnormal, I would reassess and ensure proper technique and notify the provider if needed. I am now fully deflating and removing the cuff, ensuring the patient is comfortable. In a clinical setting, I would document the blood pressure, including the arm I used and the patient's position. Some common errors when taking a manual blood pressure include using the wrong cuff size, placing the arm below the heart level, and deflating the cuff too quickly. These mistakes can lead to inaccurate readings.